So the groups that are telling your teachers to give your kids drugs are funded by the pharmaceutical companies. Ciba-Geigy funded CHAD, which in turn supplies all the schools with their informational material about ADHD. The United Nations International Control Board advised the U.S. Drug Enforcement Administration that this could be seen as hidden advertising of a controlled substance and may be in violation of international laws. Parents should know that many of the books on ADHD were written by CHAD board members. Dr. Doris Rapp, author of Is This Your Child's World?, writes, quote, repeated scientific studies have indicated that as many as 66% of ADHD-diagnosed children actually have an unrecognized food allergy causing their symptoms. This means that at least 2/3 of hyperactive children do not need these Class II narcotic drugs such as Ritalin. End quote. Dr. Sidney Walker, director of the Southern California Neuropsychiatric Institute, states, quote, hyperactivity is not a disease. It's a hoax perpetrated by doctors who have no idea what's really wrong with these children. End quote. What are the alternatives? Natural therapies to support the body's innate ability to heal itself. There are both chemical and physical irritants to a child's nervous system which, when removed, help to restore normal function. Experts on how diet relates to these symptoms recommend limiting or removing refined carbohydrates, processed foods, which contain salicylates, and dairy products from the diet. Salicylates may be found in many of the foods we eat, including many fruits, vegetables, seeds, and nuts, beverages, sweeteners, as well as oils and fats. Positive results have been reported in diets with no white sugar, no white flour, no milk, no preservatives, no wheat, no chocolate, no oranges, and no yeast. Observant parents and chiropractors have known for years that food allergies can irritate the nervous system of a child and produce hyperactive symptoms. A study in the Annals of Allergy showed children on a diet free of dairy, wheat, corn, soy, citrus, eggs, chocolate, peanuts, artificial colors, flavors, and preservatives for 2 weeks experienced considerably less hyperactivity. In a study published in the Lancet magazine, they said, quote, 116 out of 185 children labeled with ADHD responded favorably to a hypoallergenic diet supplemented by calcium, magnesium, and zinc, as well as vitamins. Dr. John Upledger of the Upledger Institute believes that many cases of these symptoms stem from a structural irritation to the nervous system. Dr. Upledger has found that many children labeled with ADHD have their heads shifted on their neck, prohibiting proper blood flow between the body and the brain. X-rays can be used to determine if there is a physical cause to a child's learning or behavioral problem. Research has shown that once the head is repositioned, these symptoms disappear in patients who have no other causes for symptoms. A non-drug natural approach should be tried before the use of addictive drugs with known and unknown side effects. According to Linda Rector, naturopathic doctor and PhD, said, quote, conventional therapies only address the symptoms of an illness, not the cause. It is clear they are not the answer in the long run. Addressing the cause of any childhood learning disorder is the first big step. Even as far back as the 1970s, the positive effects of chiropractic treatment for learning and behavioral symptoms have been known. During the scholastic year of 1973 to 1974, a research project on 2 groups of 12 students was undergone by Dr. E.V. Walton, Ph.D. of the Texas A&M University, to determine the effectiveness of chiropractic treatment on students with learning and behavioral impairments due to the neurological dysfunction. There were 13 symptom areas that were evaluated. Among these were attention span, hyperactivity, listening and reading comprehension, emotion, and behavior. In the case study, elementary students before chiropractic, students were extremely hyper, only temporarily alleviated by medication. Severe behavior problems, only 8 years old, yet Ritalin was increased 10 times the initial dosage, but with steadily diminishing results. After chiropractic, the student is not on the heavy dosage of Ritalin, is now talking, expressing herself. Reading, speed, and comprehension improved. Statistically, chiropractic treatment was at least 20 to 40% more effective than the commonly used prescribed medications. The conclusion is as follows. Chiropractic treatment is largely overlooked, but is very effective in the treatment of children with learning and behavioral problems. Quote, learning problems, symptoms are not mysterious or of unknown origin any longer. Children are being successfully treated through natural, non-drug means. What we do on the front lines to empower our school children today will empower the future of our nation. Thank you again for listening today. If you have any more questions, you can contact our office at 740-386-6580, or you can go to our website at www.ohiobackpain.com. That's www.ohiobackpain.com.